Okay, let's wake them up. Hi there. Hi. I'm so sorry to disturb you. I'm your attending nurse today. My name is Nurse V. You did come in a little while ago with some trauma to the head, and I do need to just make sure that everything is okay, take your vitals, and do a couple of tests just to be sure that we're good to discharge you in a little bit, okay? Wonderful. So, I know the nurse from earlier took down some of your information. I just want to make sure that all of the stuff on your chart is correct. So, let me just take a look at what we've got going on here. And can you tell me your first name? Wonderful. Got that down correctly. And your last name? Awesome, thank you. And can you tell me a little bit about what happened to your head? Okay, I see. So you just fell and hit your head. It makes sense, okay. Wonderful. And can you just confirm your date of birth for me? Okay. And are you currently taking any sort of medications? Any prescriptions? Okay. Got it. That's what we have down. Wonderful. And can you just verify your address, your current address for me? Wonderful. And are you experiencing any pain right now? Any pain in your head or anywhere else that is important to mention? Okay. Got it. And how long have you been feeling that? Okay. No worries there. Great. And how are you feeling in general? Are you feeling comfortable? Are you feeling uncomfortable? Okay. And mentally, are you feeling okay? Are you having any feelings of depression or anxiety? Okay. Okay. Thank you for letting me know. It's important that we make sure that you're comfortable and safe, okay? Wonderful. So I am going to start just by taking your vitals really fast. So I am just going to ask for you to give me your arm real fast, whichever one is more comfortable for you. Okay? I'm just going to gently press on your wrist here and grab your pulse. Wonderful. Thank you. You can rest your arm again. Okay, and I do just need to take your temperature. I do just have a thermometer that I'm going to stick under your tongue. So, go ahead and open your mouth for me. Yep, just say, wonderful. So I'm just going to. Okay, we'll just hold it right here. Good. Good job. Wonderful. No fever. Alright, I'm just going to take note of your temperature. Okay, so now I am going to just address. Okay, so now I am just going to address the little minor abrasions I do see up here on your head where you must have hit it. So I'm just going to take this sterile damp cloth and clean you up just a little bit, okay? Does this hurt? Let me know if I touch anywhere that hurts a little bit and I will make sure be gentle and not go around there again. And just down here. And up here. Nothing stings or hurts at all. Very good. I'm just gonna dab up here as well. Very good. Just making sure all the areas are clean. Looking better already. Okay, now I'm just gonna take a little bit of ointment, just some antibacterial, and I'm going to put this on a Q-tip and just place it on the areas that might need a little extra protection. And now I'm just going to dab right up here. And let me know again if anything feels uncomfortable or hurts at all, and I will make sure to stab immediately. And just a little bit over here. Very good. Yeah, your abrasions are not bad at all. I just want to make sure that nothing gets infected, so which they won't. They are totally clean and look just fine. This is just a precaution. So, let me just close this back up. And I'm going to just put a little Band-Aid on that for you so that you are good to go. This is a waterproof Band-Aid so that in case you start to sweat, everything will stick just fine. So, just going to stick and stick. Just going to stick. Alright. So that should be all that you need for your little wound care. Does everything feel okay? Wonderful. And how's your head feeling in general? Do you have any headaches or any weird fuzzy vision? Anything of note that's different than what you normally experience? Very good. Wonderful. Okay. So now I do have to just perform a couple of tests to make sure that everything is functioning the way that it should be, especially your eyes. That's one of the major areas that does get affected if you do have a head injury. So I'm going to take out quite a bright light. You don't have to look into it just yet. So go ahead and just keep looking at my nose. It's going to be a little bit bright. Just keep looking at my nose. I am going to make make sure that your eyes dilate the way that they are supposed to when your pupils are functioning normally. Okay. Okay, so again, just look at my nose. And bright light. Bright light. Very good. And blink for me. And blink one more time. Very good. Keep looking at my nose. Here we go. Bright light. Bright light. Bright light. Bright light. Bright light. Very good. Bright light. You're doing such a good job. Bright light. Very good. Go ahead and blink. Good. And blink one more time. Wonderful. Okay. Keep looking at my nose. I do have to look at the other side. There we go. And bright light again. Bright light. Okay. Very good. Keep looking at my nose. Very good. Very good. Good job. And blink. And blink one more time. Very, very good. Okay. Now, this is the time when you do have to look into the light. I know it's bright. It won't be for very long intervals though, okay? So just let me know if at any point this becomes painful or uncomfortable for you to perform, and you can just look behind me, okay? Okay, so look into my light, please. Very good. And follow light wherever it goes. Up here and down. Yep, and just follow the light. Very good. Just follow with your eyes. I need you to just go ahead and keep your head still for me and only use your eyes to follow, okay? Good job. Once again, just follow the light. Very good. Follow the light. And follow the light. Very good. And follow the light. Keep following it just with those eyes. Just with your eyes. Don't move your head. Very good. Very good. And was that uncomfortable at all? Did you feel any discomfort while looking at the light? I see. Okay. Now I do have to see if your eyes are functioning all right separately. So I am just going to block out one of your eyes and do the same thing, okay? So I'm just going to go ahead and put this over one of your eyes now. Is that okay? Okay. Put it over this side. And incoming bright light. Very good. Very good. Okay. Wonderful. And the other side. Bright light. Bright light. Bright light. Bright light. Wonderful. Alright, I'm just going to take this and measure your eyes. So we do have this side. Can you just look at my finger real fast? Right here. Look here. Good. Thank you. Okay. And the other eye. So just this side. And look at my finger one more time. Look at my finger. Very good. Okay. couple of notes. Okay, very good. How are you feeling? Is everything feeling okay? Are you uncomfortable at all? Okay, that's good. That's a very good sign. So I am just going to take my finger here and I'm just going to move it towards you and away from you. Okay? And we'll just see how your eyes react. Alright. Finger moving towards you. Just watch my finger. Very good. Good. Keep watching my finger. Very good. And now on this side. Keep watching my finger. Now both. This time I want you to just pay attention to my nose and do not look at my fingers as they come towards you, okay? Very good. So just look at my nose. Very good. And one more time. Good. And now can you tell me which finger is closer to you? This side or this side? Okay. And now, which finger is closest to you? This one or this one? Very good. And now, which finger is closer? This one or this one? Very good. And now, which finger is closer to you? This one or this one? Very good. Very good. You're doing such a good job. I know this can be a little tiring, especially when you have just did your head, so you're hanging in there very well. Thank you. Okay. So now, I do just need to take out this tool. I don't know if you've seen this kind of a tool before, but we do just need to make sure that your eye is functioning in light the way that it should. It's just to further analyze how your eye is functioning with light. This can be something that really affects how your head works later on, so we just want to make sure we're not missing anything, okay? Wonderful. Now I'm going to be using one of these tools. If you've ever seen one before, this might be your first time. I'm just going to hold it up to your eyes and take a closer look at some of the things that I do look for in making sure that your eyes are functioning the way that they're supposed to after you hit your head kind of hard. Just like what your brain is receiving when you see certain shapes and what kind of light does or does not affect your eyes, okay? So this is going to get quite close. Now first, I just want to know if you can see any of my fingers. And if so, how many am I holding up? Wonderful, that's 2. Okay, and now? Very good. And now? Yes, very good. And now I am just going to shine a light into your eye once more. Go ahead and just look wherever feels comfortable, okay? Can you see the light? Very good. Is it too bright? Is it as bright as it was without this over your eye? Very good. Very good. Bringing it farther away. Is it brighter now? Okay. What about now? It is brighter. Very good. Okay. Very good. That is normal. Mm. Gonna move it up here now. Wonderful. Just a little longer. Is any of this feeling uncomfortable to you? No? Okay, very good. Wonderful. Wonderful. Okay, that was a lot of work for your eye. So go ahead and just blink for me. Go ahead and blink. Very good. Very good. Okay. Your eyes do look just a little bit red. It could be just from the strain that they have taken after the impact. So I am just going to give you a couple of eye drops. Just a couple of little eye drops to rehydrate them, and hopefully that will do the trick, okay? Okay, so I'm just going to go ahead and lift up this eyelid over here. Just very gently lift it up, and I'm just going to put in a couple of drops. And one, and two. Okay. And blink. And blink. Okay, very good. And to the other side, I'm just going to go ahead and put it in here and drop. Very good. Very good. Okay, go ahead and blink 2 more times. Very good. Okay, how do your eyes feel now? A little better. That's good. These will definitely just moisten things up and make your eyes feel like new again in just a couple of minutes. Okay, so we're going to stay with your eyes just a little while longer. I do have just a little chart to see how you are reading specific shapes. So let's see here. Let me grab my pen. So let's start with this column. Can you tell me from these E's on this line what direction the legs on this one are facing? What direction? Okay. And this one? What direction are the legs facing? Very good. We'll skip down a line. Now, can you see this line? Very good. In what direction is this one going? Good, very good. And which direction is this one going? Wonderful. I'm going to skip down 2 more lines again. Can you read any of these? Yeah, okay, we'll try. Can you tell me what direction this one is? And this one. Very good. Okay. Now, can you read these numbers? Good. Very good. I'm glad to hear it. Alright, so tell me, which number is this one? That's 8. Very good. And this one? Very good. We'll skip down a couple of lines here. So, can you tell me what number this is? What number is this? Very good. And what number is this one on the end? Okay, we'll skip down a couple more lines to this one. Can you tell me what the second digit is here? What's the second digit in this line? Okay. And how about this one here? What's this digit? What's this digit right here? Okay, very good. Now, can you please read to me these 3 letters from left to right? Okay, very good. OXO. And what about these 3? XOX. Very good. XOX. And what about this one here? XXO. Very good. You're doing such a good job. Very good. We are done with the chart. I do have one last little eye test to run with you, and that is the color test. So, can you please tell me what color this is? What color do you think that is? And what about this color? What color do you think that is? Good, that's purple. That is purple. And what about this color? It's a little more difficult. What about that one? Okay. And what about this one right here? This color. What do you think that color is? Very good. A little color theory now. What do you get when you cross this color and this color? What color do you get when you cross this color and this color? Green. Very good. A little extra test just to see. Wonderful. Very good job. You did such a good job. So it looks like your eyes are functioning just right, which is exactly what they need to be doing right now. So just a couple last minute tests I do need to have you do. I'm just going to press on your shoulders. I would like for you to try and lift them up. Okay? And go ahead. I'm just going to press down. Try and lift them up. Press down. Very good. One more time. Pressing down. Try and lift up your shoulders. Very good. Very good. Okay. And now I would like you to just go ahead and raise up one finger from this hand. Good. Put it down. And raise up the other finger on the other hand. And put it down. Now raise up two fingers on both hands. And put them down. Very good. Now, I'm going to take out my light one more time. Could you please just look up for me? Look up. Look up, look up, look up. Look up. Very good. And look down. Look down. Just keep looking down here. Very good. Okay. Well, you look totally fine. Everything is functioning exactly the way that it should be. Does your head still feel okay? Very good. And your eyes? Very good. Well, then I will be taking some last minute notes just about the things that we did. But I'm just going to go ahead and release you to the front receptionist so that we can schedule a follow-up date to make sure that your head is still doing okay, which I know it will be. So thank you so much for allowing me to take this time to make sure that you're doing okay. And just go ahead and take it easy, take a rest for the next couple of days, okay? And I'll see you again soon.